Hi, I'm Professor Nicolas Horton from Paris Créteil University. Primary cutaneous T-cell lymphomas with a TFH phenotype cannot be classified using the current WHO classification. In this publication, we described a series of these lymphoma which are very rare and poorly characterized to date, but thanks to the national networks of cutaneous lymphomas, we could retrieve more than 20 cases. We believe that these lymphomas differ in terms of clinical, pathological, and molecular presentation, as well as severity compared to angioimmunoblastic T-cell lymphoma and other known cutaneous lymphomas. To make a long story short, most patients had papules or nodules with individual lesions, sometimes resembling those of the primary cutaneous CD4 positive lymphoproliferative disorder, which is a benign condition. In contrast to those CD4 positive primary cutaneous LPD, patients' outcomes were highly variable, most showing a protracted disease requiring several lines of treatments, including chemotherapy. 3 patients unfortunately died of the disease after nodal dissemination. We found that these lymphomas shared similarities with angioimmunoblastic T-cell lymphomas at the pathological and molecular levels. Firstly, we identified in 10 patients clonal B-cell population within the skin lesions, and 8 patients developed B-cell lymphoproliferative disorder or lymphoma in situ. Second, we identified in 4 patients both a ROE and a TET2 mutation, which is a hallmark of nodal TFH lymphomas and especially angioimmunoblastic T-cell lymphoma. To conclude, cutaneous TFH lymphomas thus represent a new group of cutaneous lymphoma, primarily presenting into the skin and with partial features of angioimmunoblastic T-cell lymphomas. Of course, further studies as well as longitudinal follow-up of the patients are required to determine if this subgroup should be emphasized in future classification.